Hello, and welcome to our second installment of Empowerment Washington's live stream on PrEP. We're coming to you live on YouTube and Facebook Live. Today we'll cover some of the basics of PrEP and get into the financial side of PrEP access in Washington State. This includes health insurance, copay programs, government funding programs, and other helpful tools designed to help you access the care that you need. So, although there will be some helpful information for everyone, some of the information I'll be covering today is specifically for folks here in Washington State. So, first things first, I want to welcome back the fabulous Empowerment Washington co-host, Terence. How you doing, girl?
I'm doing fantastic, Sugar. Thanks for having me back. And for those of you who don't know about Empowerment Washington, it is a fantastic nonprofit that provides safer sex kits into the community and educational resources for MSN like the live stream we're doing today. Empowerment Washington, take charge of you. You can find out more information at empowerwa.org. Now that we have all the formalities out of the way, I want to remind folks that you can write in questions starting now. We have fantastic volunteers checking out your comments and questions on both Facebook and YouTube. If you see a name on screen, reach out and we'll send you a link to get your information so we can send you some of our goodies. All right, baby, let's do this. I am ready to learn some more information.
Oh, so you learned a bunch last time?
I sure did.
All right, so you don't mind if we quiz you a little bit?
No, go for it. I'm ready.
All righty. So let's start something simple. What does PrEP stand for?
Pre-exposure something.
Correct, kind of. So PrEP stands for pre-exposure prophylaxis.
Okay.
Pre means before, exposure means that you've come in contact with something, and a prophylaxis is something that's used to prevent a disease. So it's a preventative measure similar to birth control. Terence, next question. How often does someone take PrEP?
Oh, that's the easy one. Every day.
And what about if you miss a dose?
If you miss a dose, take it when you remember, but don't take more than one.
Absolutely. Okay. So, I mean, you might as well be hosting the show at this point. You are once again correct. And if you forget to take your medicine, just take it once you remember and then get back on your regular regimen. Don't take 2 pills to make up for the day that you missed, and don't take a bunch because you're going to go to a wild sex party tomorrow. PrEP is approved for daily use, 1 pill a day, every day.
Okay.
But,
and there's not like any huge nasty side effects if you do like take a couple more?
Although there's not huge side effects, we do just recommend that you continue with that regular regimen once you remember. Don't just take a bunch.
Okay.
But since you're doing so well, let's go ahead and go a little bit deeper.
The deeper the better, baby.
Spoken like a true bottom. So on top of taking a pill every day, what else is required of someone who is on PrEP?
Okay, so you have to get tested every few months for HIV and STDs, and then some other stuff I don't remember right now.
Okay, that's fine. We'll give you partial credit for that one. You are correct that people on PrEP, they have to see their doctor every 3 months, and they get HIV and STI screenings. They'll draw blood for HIV and syphilis testing, they'll collect your urine for gonorrhea testing, and they'll have you swab any potentially affected areas. So basically, if you suck dick, they'll swab your throat, and if you bottom, they'll swab your ass. And since they're already going to be doing blood draws, they'll run some other tests as well to check your liver and your kidneys. So to reiterate, PrEP is more than a pill, it's an entire regimen. It includes all of these things, as well as using condoms and talking to your doctor about how to better protect yourself while still having the sex that you want to have. So last episode, we talked about the basics of HIV, how it's transmitted, how PrEP works, and we brought up that HIV is transmitted by 4 fluids. Do you remember what those 4 fluids are?
Yes, blood, semen, vaginal fluid, and breast milk.
Alrighty, so that is correct. So for someone to seroconvert, which means going from HIV negative to HIV positive, they must come in contact with one of those 4 fluids, and that fluid must contain enough copies of the virus to infect the HIV negative person. So HIV is a virus, and viruses don't survive without a host. And HIV in the typical human body finds an immune cell and attaches itself to it, and that is the host. PrEP stops that connection from ever being made. And so if the virus can't connect, the virus can't infect.
Makes sense.
All right, and so last week, the pharmaceutical company that produces PrEP announced that there are currently over 150,000 people in the United States taking Truvada for HIV prevention. And while that's really great news, there are still countless people around the state that could benefit from this HIV prevention tool. So side effects are mild and pretty short-lived. Plus, research has shown that PrEP is up to 99% effective against HIV infection. So why are there still so many people who could benefit from PrEP that aren't on it? And there's a whole slew of answers to that question, but the one I see most often is money. Doctors can be complicated, insurance is pretty confusing, and entering into a PrEP program can be expensive. So what a lot of people don't know is that there are funding sources for every piece of the PrEP process. The doctor visit, the copays, the labs, and even the medicine itself. And today we're going to be talking about those resources and how those people can utilize these resources.
If you're just joining us, I want to remind folks watching this from outside of Washington State that many of these funding sources we'll be talking about is specifically for Washington State. So for further information about resources available to you, contact the HIV and STI division of your local health department or an HIV and AIDS service organization near you. Like this beautiful man I have sitting next to me who works for PCAF.
So one resource that is available to everyone, regardless of your geographic location, is the Gilead Copay Coupon Card.
The Gilead who?
The Gilead Copay Coupon Card. And this program is offered by the pharmaceutical company that actually produces Truvada, which is the medicine component in PrEP. And it gives you just short of $5,000 per year to put towards the cost of the medicine. There's no monthly limit, which means you can use it to pay for every penny of your medication until you use it all up, because the medication is pretty pricey.
Pricey. So how pricey are we talking?
Well, if you pay out of pocket, it's about $1,500 a month.
Okay, that's a little pricey.
Yeah. But like I said, with the Gilead Copay Coupon Card, whether you have insurance or not, it's going to cover about $5,000 of that cost, which is roughly 3 months if you use it to cover your full expense every month. But I do have to point out that's just for the medication. So office visits cost money, and sending off your lab specimens costs money too. So every 3 months, that's a whole new set of labs and another office visit charge on top of that.
Wow, that is good information. I had no idea how expensive it was to get on PrEP. Are a lot of folks who are looking to get on PrEP surprised by the cost?
Yes, cost is definitely the #1 barrier that I see when people come into my office. But hopefully this can kind of help eliminate that initial sticker shock that you might have, because there are multiple ways to get things covered. So if you don't already have health insurance, our first step will be to see what insurance plans you might be eligible for. People in Washington State, Washington is an expanded Medicaid state, which means you can qualify for government-funded health insurance based on your income alone. This program is called Washington Apple Health, and it works to set up lower income folks with health coverage. So to qualify for completely free coverage, your income must be below 133% of the federal poverty level, which is about $1,300 to $1,400 a month. And if people are on Medicaid, Apple Health, all PrEP services are free.
So what about people who make over the 133% of the poverty level and who don't qualify for Medicaid?
If you don't qualify for free coverage, you might qualify for what they call a qualified health plan. And that's for people who make too much money for Medicaid. They can pay a monthly fee and they receive the same or similar insurance to people on Apple Health. It's kind of similar the way that private insurance works. You pay a little bit and they help cover. If you have private insurance, you can contact your provider to see what PrEP services they cover. And in Washington State, we also have a program implemented by the health department, and that's called PrEP, which stands for the PrEP Drug Assistance Program. And this program not only curbs the cost of doctor visits and labs, but it also has a few other pages worth of other healthcare services, typically sought out by people who use PrEP. And so these are things like STD and STI testing, as well as treatment. But there's also things on that list like mental health assessments or to get your annual vaccine for the flu or your HPV vaccine. So really simple things are on this list as well. And a little added bonus is that even though the drug assistance program is paying for these things, it's going to count towards your deductible. So let's say that your employer provides you with some pretty bad insurance where you have high copays and high deductibles and like mediocre coverage. Don't let that be the reason that you're not going to get on PrEP. We can sit and talk with you and kind of assess your situation, and from that find out what funding sources would work best for you. Because part of my role at PCAF is being a PrEP navigator. And basically, it's a case manager for people who are on PrEP or interested in getting on PrEP. You can schedule an appointment with me and we'll talk about your exact situation to find out what type of help we can provide you with. So if you're uninsured or uninsured, documented or undocumented, whatever your case is, we're going to do our best to break down any barriers you may have. We have funding sources, we have a resource list of doctors who provide PrEP, all these different things to break down any barriers that you may have standing in the way of you getting on PrEP. But I do want to go ahead and take a little bit of time and answer some questions from viewers.
Yes, let's see what we have so far. We have a question from Jeffrey. In terms of HIV transmission, does pre-cum count as semen?
Yes, pre-cum does have HIV copies in it. The difference that you want to think about is how is it going to access the body. So with pre-cum just kind of typically sitting on the head, it's not going to go as far in the body as the actual ejaculation, the cum shot. It's going to go, the cum shot's going to go a little bit further, so it's going to hit more areas in the body. So yes, pre-cum will hold copies of the virus and everything, but it's not going to hit as much exposed skin in the bottom's body. Okay. So yes, pre-cum can transmit HIV.
Good question, Jeffrey. The next question we have is from Joey. Is there a subsidy available for this really expensive prescription drug?
Yeah, there's multiple different funding sources. So especially for someone in Washington State, we do have PrEP. But one important part of PrEP is that you have to see a provider on the PrEP list. There are tons of lists or tons of people on this list from every part of the state. But if you see one of these contracted providers, then PrEP will eliminate some of those costs. And if you're talking about the medicine cost by itself, then the Gilead copay program will help alleviate some of those costs. Okay. And a lot of health insurance do cover it as well.
That's good to know. Our next question. What do I do if a condom breaks, and if I don't know the status of the guy, what options do I have?
Okay, so for this situation, let's say that this is someone who is not on PrEP. You're not on PrEP and the condom breaks, you have no idea. There is another thing called PEP, which is post-exposure prophylaxis, and you take it after the fact. So instead of taking a pill once a day, this is something that you take after you think that you might have been exposed. And so you visit an ER. Some urgent cares have it, but I highly recommend ERs because all ERs should be covering it and should have it on, in their pharmacy. They give you one HIV medicine, and then they also give you 28 to 30 days worth of Truvada, so the medicine and PrEP. And you take the first pill in the ER, and you take your first dose of Truvada in the ER, and then they give you the rest of those. And you continue taking those for a month straight. If you catch it within 72 hours, 72 hours after the condom breaks or after you're potentially exposed, PrEP is up to 80% effective in HIV prevention.
Okay. What if my doctor doesn't know about PrEP? Should I find a different doctor?
Not necessarily, but sometimes you might have to. There are cases where doctors either don't know about PrEP or they refuse to prescribe it. So they can do their own research and they can see and say, you know, I don't feel comfortable with that. Before I moved to Washington State, I consulted my doctor about it and he wanted me to sign like a legal waiver and like all this other wild stuff.
To get on PrEP?
To get on PrEP, saying that I would not sue him if I seroconverted. So there are doctors out there that aren't necessarily PrEP competent. It doesn't mean that you have to see a new doctor just because of that. Some of it is just educating. You can try and educate your doctor, and if there's still kind of that resistance, there are a whole list on the Department of Health's website of PrEP competent providers. And so if you go to the PrEP page on the the Department of Health website, that's all available to you. It doesn't mean that you necessarily need to see a new doctor. Your PrEP prescriber doesn't have to be your primary care physician. So you could go and see one of these providers and literally only see them for your PrEP coverage. You just go there every 3 months, talk about PrEP, nothing else. And that's totally fine. And you can have your other primary care physician and you see them for everything else. You sprain your ankle, you get pregnant, something like that. And it's totally fine. The great thing about that is that you know that you're going to this doctor just for PrEP stuff. You know that PrEP is going to cover it because you're just seeking out PrEP services and nothing else.
That's so good. Okay. We have a question from Billy. I need to get an LGBT doctor that accepts my insurance in Everett area.
Again, definitely check out the DOH, the Department of Health website. Anyone that's on the PrEP list is going to be a queer competent provider. Any of them we have talked to, we have set up contracts with them, and they're going to know what type of care that you're going to need.
All right, our next question. Billy, to follow up with Jacob after. So Billy, you can follow up with Jacob after the web series is over for more questions about that topic.
Yeah, absolutely. Email me, call me at PCAF, and you can go ahead and sit down and talk and find you a good LGBTQ competent provider.
All right, so we have another question from Tim. Do guys still use condoms on PrEP?
So PrEP, again, like we talked about earlier, is a regimen. And with that regimen, people are supposed to be continuing to use condoms. When we talk about the effectiveness of PrEP, it's with the use of condoms still being present. Mm-hmm. I know that some people on PrEP do use condoms, some people on PrEP don't use condoms. Some people 50-50 use it. Everyone's different, everyone has different sexual needs. But when we look at the effectiveness of PrEP, when we talk about that 92, 97, 99% number, that is PrEP, Truvada, the pill, in conjunction with condom use. In conjunction with every 3 months going to see your doctor for STI screening, getting those STIs treated, getting your HIV testing, all of that stuff. Risk reduction counseling, talking to your doctor about how to protect yourself but still have that sex that you want to have. Mm-hmm. That's where we get those effectiveness levels. So yes, people who are on PrEP definitely still use condoms. Some people don't. It's a personal decision, and every case is definitely different.
Wow. All right. We have another question from Alex. Who is PrEP for? Like, who is it recommended for?
So the CDC online has a whole guideline for who PrEP is for. PrEP is always for people who are HIV negative, and then there's a little bit of like subsections of who it could be for. So someone who is in what they call a serodiscordant relationship. So someone is HIV negative, their partner is HIV positive. If you are going to be continuously having sex with that person, it might be wise to get on PrEP. That's one example. There's also people who are having large amounts of partners, or people who engage in condomless sex, and then also intravenous drug users. So people who use needles to shoot up drugs. Those are all people who might benefit from PrEP, but you don't have to necessarily fall within those lines. If you are HIV negative and you engage in sex or intravenous drug use and you just feel that you are at risk for HIV, if it's going to offer something to your life, be it peace of mind, whatever it is, then PrEP could work for you.
So it's not necessarily a drug that's only advertised for gay people.
Exactly, yes. We have straight people who are on PrEP. We have people of all sexualities, all identities are on PrEP. You don't have to be gay, bi, whatever to be on PrEP.
Okay. Our next question, is HIV really still an issue for gay men? Isn't it almost gone?
No. A lot of people think that. HIV is not seen in the media like it was in the 80s. I wasn't alive then, I wouldn't know. But HIV is not advertised the way that it used to be, but there is still an estimated 50,000 new infections every year. The question did mention gay people. Those aren't all in the gay population.
That's good to highlight.
Yeah. But HIV is still prevalent. HIV still exists. You know, with 50,000 new people, remember that those are 50,000 new lives. Those aren't just numbers, those are people. With that many new infections, yes, HIV is still prevalent and still relevant. We don't talk about it as much because it's not seen as that death sentence that it used to be seen as. You know, we saw in the 80s and the early 90s that before some of these drugs were out, before some of these HIV medications were out, people would find out they were infected and have a couple months to live. So because it has changed from being this death sentence to this very livable condition that can be treated with medicine, we kind of stopped talking about it as much. We stopped blasting it on TV like we used to. But it's still an issue. There's still people who are receiving new diagnoses every year. And it's still something that needs to be talked about, still needs to be brought up. And that's the wonderful thing about talking about your status with your partner. That's why I think it's really cool that Grindr added that little part where you can say, what's your HIV status? Are you positive, positive undetectable, negative, negative on PrEP? These are all really good, helpful things that keep the conversation going about HIV. And keeping the conversation going is a form of HIV prevention in itself.
Okay. So just to make things clear, PrEP is something that helps you prevent getting the HIV virus. It doesn't reverse it.
Correct, yes, yes. It's not like a cure for HIV. PrEP is for people who are HIV negative. That's also a common misconception I've come across, especially on Grindr. A lot of people do think that PrEP is for people who are HIV positive. PrEP is only for people who are HIV negative, which is why they do the testing every 3 months. Yes, there's currently no cure for HIV, and right now PrEP is our only biomedical form of HIV prevention that we have right now.
Oh. All right, so can you tell me more about what PCAP does and what your job is exactly?
So I work in the prevention department. It's a one-woman show here in the Olympia office, and that woman is me. And so I do quite a bit of things. I think the phrase is wear different hats. So a lot of what I do is testing. I offer testing every single day of the week except for Wednesday. And if someone wants to walk in, we do walk-in testing on Friday. And so that is HIV testing. We have rapid tests. So we have one test that takes 1 minute, and then we have one test that takes 20 minutes. They just have different window periods. On top of that, we do condom distribution, just like you folks at Empowerment do. We provide condoms for bars, for restaurants, coffee shops, clinics, all around Olympia, Thurston County, all those areas. And then I also, like I mentioned before, do PrEP case management. We call it PrEP navigation. And so someone can call me up, schedule an appointment, and if they're confused about any part of the PrEP process, whether that be talking to their doctor or the money thing is an issue, whatever their problems are, I kind of help them with that. So they come in, we sit down, and we find out exactly what their situation is. And based on that, I can kind of decide what funding sources are available and, you know, what information they need, whether, you know, if they need to talk to their doctor, we can provide them with a brochure that talks about how to talk to your doctor about PrEP. You know, my doctor doesn't know about it, things like that. Basically any part of the PrEP process. With that, I can, let's say that it's 2.5 months later and your 3-month checkup is about to be in. I can call you, I can text you, I can email you, whatever you need to kind of remind you to make sure, because it is a new process for a lot of people. When you're first getting started on PrEP, it is a little bit unusual for, let's say someone's in their early 20s, to go every 3 months to the doctor isn't really normal. Not that it's not normal, that's not something that you're used to. And so these little reminders kind of help. But any process of the PrEP navigation, any process part of PrEP, I can help you with that. And that's a lot of the things I do. We do outreach, so you'll see us at Pride. I do outreach at schools, outreach at clinics, all these different things, education pieces of talking about HIV and STIs, whether it be to high school students, college students, providers, whatever it may be. We do quite a bit.
That is awesome. Well, let me get one more question in before we move on. So, refresh my memory. I know that PrEP is not something that you could just take right before you go and have sex. You have to take it, and how long do you wait until, you know?
Gotcha. Yes, awesome question. Really should reiterate on that. Like you said, PrEP is not something that you just take whenever you're about to have sex. PrEP is once a day, every day. And for full use, you have to wait, for people with penises, 14 days of continuously taking the medicine, and then people with vaginas, 21 days of continuously taking the medicine.
For it to start being effective.
For it to be as effective as possible, for max effectiveness. So once a day, every day, and not just when you're about to go to an orgy. So I do want to thank you all for watching our live stream. I'm Jacob from PCAF. Feel free to reach out to me if you have any questions that we didn't get to, and I'm always open to feedback.
And I'm Terence from Empowerment Washington. Take charge of you. For more information, please visit empowerwa.org.